Hello everyone. In this session, we are going to see PSUR section 18 that talks about integrated benefit risk for the authorized indications. So in this particular sections, usually the MAH should provide overall appraisal of the benefit risk of the medicinal product. How he will provide in this particular section is already we have discussed about characterization of the risk under section 16.4 and characterization of the benefits under 17.3. Based on this, now we have a risk as well as the benefits. Now they are performing a integrated analysis, that is a critical analysis what they are performing. They are kind of the measurement means how benefit and what are all the risk, whether the benefits are overcoming the risk and that particular medicinal product is safe using for the particular patient population for the authorized indications or not. So that's they are going to perform. So in this whatever we have performed the risk, that is fine. What are all the benefits, that is fine, because here you have presented a detailed way in these particular sections. In this section it should not be a duplicate of whatever we have performed here. We can't carry forward. Here we need to use the key risk and key benefits. Those are all the very important things what they are going to use in this particular thing. Here you could have the n number of risk and n number of benefits, that is fine. Which key risk and which key benefits you are going to draw, and based on that you are going to perform a critical analysis. In this particular section, usually the global medical safety or the global medical vision, whatever the company role they have, they are going to perform this particular thing. This section actually divided into two subsections. One subsection which will talk about 18.1 and 18.2. So in this section 18.1 and 18.2, this particular section has been divided into two. And in 18.1, it's a kind of you are providing justification that why your medicinal product is important to the market, and what is the medical need of your medicinal product and for these authorized indications. And if your medicinal product is not available in the market, what are all the alternative therapies are available in the market. That also you have to provide some kind of thing, that if you have this medicinal product is not available, what are all some of the surgical alternatives you have in types of any cancer therapy, or what are all the other medicinal therapeutic class are available, and even you can say, because there are no other alternative treatment also available. So here you are going to talk about what your product, how it is making a role in the for these authorized indications, and what are all the alternative therapy are also available in the particular market. Okay. This talks about the BR context, what is your medical need and important alternatives. So that talks about 18.1. In 18.2, the final BR analysis evaluation is being performed in this particular section 18.2. So here we spoke about 18.2, which talks about the BR analysis and evaluation. So we need to keep it in few factors and few things in mind when we are deriving this particular section. Is like as we said earlier, like key risk and key benefits to be a core thing what we need to think, and context of using the medicinal product in terms of this particular medicinal product is authorized for which condition and which seriousness this particular product to be treated, and what severity of the patient should receive this particular thing. So those things and all should keep it in mind. And when you are focusing on key benefits, what is the nature of benefit, and how well this particular in clinical importance, and what is the duration and other generalizability. Example, when you are using this particular product, other products are not responding, example steroids or something which is not responding to them, so that's the reason this particular product is being used in the well in the market as well. And also it gives some alternative therapy. Along with the alternative therapy, when you give this kind of medicines, it's working well. So these are all the factors you can keep it in mind when you are thinking about the key benefit of this particular product. And also when you are talking about the key risk, again you need to think and keep it in mind that the nature of the toxicity, what this particular risk of the safety concerns and the this particular medicinal product has, and what is the seriousness, how frequently these particular risks are occurring in the population. And also we need to think how well it could reverse, and how could it can preventability, reversibility, predictability. So those things are keeping it in mind during this particular thing. And also these particular risk, whatever we have discussed, whether these risk or in the clinical trials, whether these risks were unauthorized indications whenever the things are getting used, when these risks are happening, that also we need to keep it in mind. Example, when the patients are using off label or misusing the particular product, whether these key risks are happening. So those factors are, we need to keep it in mind. And yes, these risks are happening, but these risks were under control comparing to the benefit. That's how the medic will decide, and that will continue in the overall summary. And also we need to explain the limitations, so the limitations of the assessment also should be described. And the MAH should provide a very clear explanation of the methodology, reasoning, everything, it should be in very clear. And if there are some assumptions, considerations, medical judgment, uh, when you are providing that conclusion, that should be very clear. And also if we use sometimes semi quantitative or quantitative BR, risk is provided, and we need to provide a summary of methods whatever we have used, that also need to be explained here. And at any cost, economy should not be coming into picture. So whenever the BR should not be considered in BR, should be considered in the terms of economy. So always safety comes first, so we need to focus only on the safety aspects. And if you are taking some risk minimization measures or whatever, if you are taking, but this is very costly, or that's the reason these things can't be implemented, those economic factors should not be ruled over the safety. That also we need to keep it in mind. These are all the overall at entry level understanding. This is fine. You can connect always with some global medical safety, or any medic, or safety scientist vehicles, you can connect with them always to understand better how these things are getting explored, and it has been drafted at basic level, entry level. This understanding is okay. Thank you. We can